Here's a tricky NCLEX question. A patient hears voices but seems calm and happy. What should you focus your assessment on? Stick around to find out. We're breaking down auditory hallucinations and cultural competency in psychiatric assessment. Assessing thought content is crucial in psych nursing. If a patient reports hearing voices, don't panic, but don't ignore it either. First, determine if they're experiencing auditory hallucinations. Ask what they're hearing, who they think is speaking, and how the voices make them feel. If the voices are command hallucinations telling them to harm themselves or others, it's an immediate safety risk and requires urgent intervention. But here's a cultural competency moment. Western cultures typically view hearing voices as a sign of mental illness, often with negative or harmful messages. However, in countries like India and Ghana, hearing voices is sometimes understood as communication with spirits or ancestors and is not always distressing. The voices are often positive or even comforting. Up to 15% of people hear voices at some point in their life, and that number rises with age or medical conditions like epilepsy or infection. But only about 1% are diagnosed with schizophrenia. The stigma of hearing voices is real, and some patients are afraid to report it. That's why cultural context is critical. Always ask about the content, tone, and cultural meaning of the voices. If a patient reports hearing voices telling them to harm themselves or others, always take it seriously and take immediate action. Command hallucinations are a major safety risk. Make sure to ask about suicidal or self-harm thoughts directly, and never dismiss their answer. We'll go in-depth on this in our upcoming video on comprehensive suicide and self-harm assessment. Alright, for our NCLEX question, did you get it? You should assess the thought content first and foremost. Is the patient hearing command hallucinations to harm themselves or others? A calm, happy patient might be having a culturally appropriate spiritual experience rather than a psychiatric issue. Listening without judgment is key to effective psychiatric care. You got this. Yes, you can. Master Auditory Hallucinations Assessment. Don't forget to subscribe for more NCLEX wins.